You can use the hip hook to release many different parts of the iliacus muscle. As you can see, this muscle is huge. We talk about how it is located right inside the pelvic bone, right, the front of the pelvis is right here, top of the pelvis is here when you put your hands here. This area is big. It's the size of your hand. So if you look, there could be muscle tension way up here. There could be muscle tension all the way down here. So I'm going to talk to you a little bit about how to use the hip hook to release different areas. So when you first use the hip hook, the main instructions is to find this bone that sticks out the most and put the hip hook right inside. This oftentimes is a really juicy spot and it's a great place to start. But if you're always going right here, you're going to be missing all of this real estate here and all of this real estate down here. So, if I kind of show you with the hip hook, you can see how this tip can go right here where the iliacus muscle is. And depending on how deep and relaxed you can get, it can go a little bit deeper. But then there's all this area up here and all this area down here that you can work on. So when you're using the hip hook on the ground, that first spot is right inside that bone and with the handle kind of perpendicular to your body. And then again, of course, you need to make sure that you're pushing on the lever in order for it to rotate to press on the iliacus. Now you can actually, I'm going to show my belly a little bit here, you can actually move it up a little bit more. So here's my pelvic bone, the top of my pelvic bone right here. And I'm moving it up so it's more towards the top of my pelvic bone. And I can, from this spot, push on the lever to put pressure on the upper part. I can even rotate this a little bit up towards my head as I'm at this upper part of the iliacus and put pressure here. So again, here's the top of my pelvis now, and you can see I'm way up high versus the initial spot that you were working on probably was lower, much lower here. So all of these, you're just moving it up a little millimeter, trying to rotate it out, trying to rotate it down. We'll find different spots. Now, in addition, you can actually go lower. So the crease of my hip is right here, right? This is where my hip bends. So anywhere above this crease is fair game. So again, that bone sticks out here. My crease is here. So I can actually move it a little bit lower to get to another part of the iliacus. I can also rotate it downward and push on the lever, which will get kind of underneath that that crease and that inguinal ligament, which will then help get at some of that lower part of the iliacus. And this is a spot that's actually very tight in a lot of people. I'll show you quickly on the skeleton just to reiterate that. So when we were up higher, we were getting at some of these areas here. This is the main area that we talk about in the instruction manual. And then when you rotate the tip, you're actually getting kind of down into where the psoas and iliacus meet. If you rotate the tip down and you're rotating the hip hook in, you're getting at some of this really juicy spot here. So I'd encourage you to explore all of these areas because sometimes muscles will release tension here, but they'll still hold tension in a different part of the muscle, and it will really benefit from pressure in a different area.